everyone could come off mute for a second and announce that they're here, that'd be great. So if you could.
Sharon DeQueer.
Hi, Sharon.
How you doing?
Hi. So, Sharon, and I think Meta's here too, right? Are you here, Meta?
Yes, I think she is because she just texted me.
Okay, cool. So we have Baton Rouge, Bay Area. Do we have you here? Okay, so I don't hear anything from anyone from the Bay Area here. Do we have Michigan here? I think Deidre checked on the computer. Are you here, Deidre? And Pat, Clark, are you here as well? Oh, okay, Deidre, I see. And Pat's on the phone. Okay. And Pat, did you check it? Pat?
Excuse me.
If folks are not able to get on the webinar, if you can check in on the phone and just let us know that you're here, that would be great. Just star 6 to unmute.
Oh yeah, Ebony, I saw you said it won't let you unmute. You can just hit star 6 to unmute.
Okay.
All right. Lapina, you're here for Tampa, and Janet's coming or with you already, or? Oh, and we just saw your check-in. Thank you, Veronica. Hi, welcome. Oh, and it says you can't mute. This is weird. Okay, let me. Same for you, Veronica?
Oh, because it's in listen-only mode.
Oh.
Here, I'll put it in.
Okay. Thanks for letting us know about the
All attendees are muted and may unmute themselves by pressing star 6.
Okay, so now star 6 should work to unmute. My apologies. I had it on listen-only mode.
Okay, this is Lapina Reed.
Hi, Lapina.
And
Veronica, thank you.
We'll be on soon.
Hi, Veronica.
Rachel from San Diego.
Hey, Rachel. And Rachel, is Heather joining us?
I just texted her, and she hasn't texted me back yet.
Okay, all right, thanks.
So this is Ebony. I think I can finally be heard.
Hey, Ebony.
Hi, Ebony. We can hear you.
And Ebony, you're with Sharon? I can't see her anymore.
Yes.
Okay, great. Hi to both of you. Welcome. Okay, so now I don't think I've heard just from the Bay Area now. Are Cindy and Lauren here? Okay. All right, well, we'll go ahead and get started. Thank you all for being here. Happy Friday. As I said, this is our last webinar training before getting the project going and started. This is being recorded, so y'all can listen to it later as well. Nan and I are going to monitor the chat box, so feel free to ask questions on there and come off of mute pressing *6 if you have questions and can't type them or just want to ask them. So Nan's going to start us off. Nana's going to start us off, and then we'll have some points for questions and stuff too.
Great. Okay, thanks, Marissa. Welcome, everyone. So what we wanted to just kind of go through today is we're basically going to talk about exactly what the implementation process is going to look like. So I know there have been a lot of emails flying around. You all have done a lot of work to contribute to the survey, and we're excited to have a final version ready to roll. So we're going to talk about what it actually is going to look like to implement the survey out in the field, and other kinds of data collection we'll be doing. We'll also talk in the context of that about an outreach plan. So these are all number one because they're all really important. So we'll also talk about outreach plan, how to kind of think about who we're prioritizing to target, because we want to make sure that there's some logic to who we're recruiting. And so that, if you have 20 women in your area, there's something meaningful that we can look at among them. So that's why we're going to spend some time talking about outreach plan and getting some sense of what you're thinking. Then we're going to talk about other kinds of data we'll be collecting separately from the survey. So, for example, documents, we've talked about collecting some other kinds of data. We'll go into that. We'll brainstorm about it a little bit, and we'll make some comments about what we think are maybe the best sources of trying to flesh out and fill out the rest of our questions that we can't get answered in the survey together. And then we'll go over the survey and kind of the actual instrumentation of it and some next steps. So that's what we're going to be doing today. So in terms of the implementation process, here's what we're going to discuss. It's quite a few different things. So we're going to just review again the purpose and the goals of the project, the logistics of it, what the timeline looks like, what you can expect from us in terms of support from the national office, what we expect from you all as the researchers out in the field doing this work, and we're going to go over specifically the informed consent and the honorarium process for the incentives for the surveys, because I know there were some questions around that. So our purpose, again, is to basically, this is in the broadest terms possible, we want to figure out what's going on in terms of care for women living with HIV. And then more specifically, what we've articulated kind of together is that we want to look at this in a few different ways. So one is we want to look at what's going on in terms of medical care for women with HIV right now. How well are the medical care needs being met in these 7 geographic areas that you all are in? Then secondly, we thought it was really important, and this came up a lot in the questions that you all had and brought to us, was the importance of looking at not just medical services, but all of these other factors that we know are critical to keeping women in care, that range from traditional kind of Ryan White funded services like childcare, transportation, housing, some of the stuff which has been going away, to other kinds of services that that you all identified that aren't being addressed, like trauma-informed care, for example. So we want to look at that as well. And then thirdly, we really want to figure out, once we are looking at, as we are looking at what women are currently getting and not getting, we also want to kind of be able to look at what's been changing. What are the trends? We're hearing, as we've talked about on a couple of the webinars, people are seeing different things play out in their jurisdictions. They're seeing, folks are seeing trends towards funding certain kinds of services for certain populations and not others. Women are being deprioritized in some cases. Certain kinds of services are being deprioritized, especially these non-medical services. Some programs may have shut down or closed. So we really want to be able to kind of like quantify and describe that. And so that's what we're going to be also trying to figure out in this process. And so as you can see, you know, the first two and some of the third are things that we can figure out to some extent in the survey, but definitely there's stuff in number 3 that we're not going to be able to figure out just by doing a survey of women living with HIV, and that's where we might need to do some other kinds of data collection that we'll discuss later. So we really want to be able to say, you know, in these 7 places, what's going on in terms of these changes? Are things getting better? Are they getting worse? And if we're going to say that, how are we going to back it up? What's our evidence? And the whole reason is, again, you know, because we want to be able to advocate with this information, and we want to be able to advocate from a position of expertise and knowledge and authority, and we want you all to have the information you need in your local areas to be able to make an effective case for services for women with HIV, while we're also making a case at a national level. So what are we going to have by the time we finish this project? Well, here are the outcomes we are moving towards. We want to know to what extent the care and treatment needs of women with HIV are being met. And we separated those out, right, because we know that treatment is not care. There's care, there's treatment. There are different kinds of barriers to each. Sometimes they're the same, sometimes they're not. And so we want to talk about all of that. We also believe that, you know, as PWN, a really important part of everything we do is building power, building capacity among women living with HIV and among all of us. So for all of us, I think this is the first time doing a project like this. So in this process, we want to learn together. We're co-learning to engage in research and data collection. And we hope that this experience is something that, you know, you all will be able to kind of learn from, take some skills from, and be able to use more in the future as well, and that all of us as a collective network and organization will be able to better think about, you know, in the future, what other kinds of research projects might we want to tackle together as a national network. So really thinking about how research that's grounded in the community can help to inform advocacy strategies and policy. And then thirdly, you know, our final product is going to be a report that's based on these findings, and we're going to be using it because we know there's going to be a battle around Ryan White reauthorization, and the battle is not only going to be whether it should happen, but how it should happen. And so we want to be as prepared as possible to say, these are the most important things women need to get out of the new Ryan White, and here's the data to back that up. And so we want to, you know, not just make assumptions about what's important, but to really be able to say why and how it might look different in different places, and you know, how it might look different in places that have a Part D program, for example, than places that don't, and places that have Medicaid expansion and places that don't. And so you're in very diverse geographic areas, and we want to be able to sort of paint a picture and make some recommendations together based on that picture. So that final product will be a report. We're hoping, in terms of the timeline, what we're aiming for, and we'll talk about this too, is you know, to release that report at USDA this year, so that folks can really use it as an advocacy tool in the fall. So again, just kind of reviewing. Well, maybe I'll just stop for a second and see if there are any questions, first of all, about what I've described as the purpose and goals and the outcomes. Any questions? Is this all sounding familiar? Does it sound like what we talked about? Star 6, unmute again. Okay. I think you all are pretty familiar with this. So I'll keep moving on. If folks have questions, feel free to type them in or come off star 6 at any point. So when we did our kind of brain dump together and talked about what are all the things we really need to know, we had a list of it was probably like 100 questions, right, that we came up with together that you saw in the document that was emailed out to all of you a couple of weeks ago. And we went through that document and we grouped the kinds of questions into what we call domains. So these are like research domains, meaning like areas that we're trying to find out information in. And so there are basically 5 different domains that we're looking at together here. And one is specifically the unmet need for care and treatment. The second is unmet need for services that support engagement in medical care, so not just care and treatment, but the stuff that helps women get there and stay there. The third is really wanting to know about the quality of care women are getting. So it's not just enough that you're getting care, but like how good is it? Is it working for you? How do women describe the quality of their care? What is quality to women living with HIV? And then what is the quality of the actual systems and the healthcare infrastructure? Like what's going on at a systems level? Are there more resources? Are there less resources? How are things changing, especially right now in this very transitional environment with Affordable Care Act implementation, Medicaid expansion, budget cuts, all these different things going on? How is that changing? And that really gets us to number 5, which is the changes to the quantity and the quality of women-focused services available. So these are the basic areas we're trying to cover in this project, which is a lot of different areas. And what you'll see is that really it's the first 3 that we can best figure out through the survey that was sent out and designed. We probably can't really figure out the last 2 that effectively from the survey questions and the survey responses, and that's where we're going to be leaning on other kinds of data and trying to think about what else we can collect that will help us to paint the picture of what's happening for these other 2. So, in terms of how the survey works, you all took the example of the survey, right? So the survey is currently online. We created a small URL for it. It's called a tiny URL. This is just to make it easier to remember, easier to disseminate. You don't need to memorize this or anything. We'll be sending it out to you. You'll have it in paper. You'll also have, not the survey in paper, but you'll have this link written down on a piece of paper. You'll also have it in your email, so it's easy to get to. There is no paper survey. There's only an online version of the survey using SurveyMonkey. And the reason for that, again, is to reduce the data entry piece of this because we don't have, unfortunately, the resources to do the data entry, the manual data entry to enter results from a paper survey, which is kind of unfortunate because we want to make sure that women who don't have internet access are really getting to respond to the survey. And so part of what we want you all to think about and that we'll spend time talking about when we get to the outreach plan is what ideas do you have about ways to reach women who are not online? So for example, recruiting women from support groups to participate in the survey, taking a laptop there or finding a computer at an agency that will let you use one and having women literally come and sit down there and do the survey, even if they don't have internet access. Because if we had only women who had internet access take the survey, it would be a very biased sample. It would look really different. So yeah, Pat, I see you putting an idea in there. Great idea. That's like a fantastic idea. Taking your iPad somewhere, meet the woman, maybe, I don't know if some folks, you might want to go one by one and meet different women. There might be people who can set up a time when you can say, I'm going to be stationed at this one place. You come at 1 o'clock, you come at 2 o'clock, you come at 3 o'clock, you come at 4 o'clock, and just sort of knock out a bunch of them in the afternoon. So, just thinking about what that might look like in your region, and we know that some of you are in more rural areas than others, and it's going to be a little bit harder to get around. And so just thinking about that. I see all these great ideas coming in. Meeting at a library, and Pat, you're saying you've done this before, so this is really great. And I think when we get to the outreach plan, we're going to spend some time really hearing from each of you what that might look like in your areas. So that's the logistics. We're going to be sending you a bunch of stuff too. So you'll have the online survey. That link is going to be live and ready to go basically Monday. But we're also going to mail you packets next week. You should have those by the end of the week at the latest. And these packets will have a written instruction sheet, but you'll also get an email. You'll get everything here in your email as well, except for the actual gift cards. So you'll get an instruction sheet that's here's exactly what to do. You'll have a script that you can use to describe the project, and the script is basically very similar language to the informed consent form. So it's basically just explaining what the purpose of the project is. It's something that you can use if you want to announce it at a meeting or a support group. You can also use it when you're explaining directly to a woman, when you're introducing her to the survey she's going to be taking. You can use a script. You can, you don't have to stick to it exactly, but it just is a guideline for you all. We'll be sending you informed consent forms, and Narissa's going to go over the process for what that looks like. But this is important for protecting you and for protecting the participant as well, to just make sure that we have their consent to participate in this research project. And as you probably noticed on the SurveyMonkey, there is no place for them to put their name. Their name is never going to be connected to this data. So we're really hoping that folks will feel very comfortable giving us information that we realize is highly personal, because we're never going to know who they are. And there's no association between their name, their informed consent form, and the actual online data that's submitted. So that is exactly, that's how we'll maintain confidentiality and make sure that people's personal information is never connected to their name or identifying characteristics. Then we'll also have these gift cards that we'll be sending to you all. So each team is going to get 20 gift cards in the amount of $20. And is that right? That is right. Yeah, okay.
We'll talk more about that.
Yeah, we're going to talk more about that in a little bit. And you all can figure out, how it makes sense to split those up. If some of you might not be in the same place, some might be in the same place. So we'll talk about that later, and we want you all to kind of figure out how you're going to distribute those, what makes the most sense for you. If, one person's going to be doing a lot of the surveys, somebody else is going to be doing more of the other data collection, or if you are going to do them together, or, how you're thinking about that. We'll also send you a form that you'll have to have folks sign off on when they get their gift card, and then you'll have an envelope that you can use to mail back the informed consent, the incentive form, all of that stuff back to the office. We're also sending you an outreach flyer because folks asked for that. Narissa made you.
Oh yeah, sorry.
Narissa made a nice flyer that you can basically use just to recruit women. So it's something that you could put up in like a clinic or in a community-based organization, in their, on their bulletin board or something. And there's a place on the flyer where you can actually add your contact information, so there's enough space for you to type it in there. We're going to send it to you in Word so that you can do that. We'll mail you copies also, will we?
We can mail you all copies if you let me know what contact information you want on there. I'm happy to print some, maybe like 10 or 15 and mail those along with your packet. I'm really happy to do that, but you just have to let me know what contact information you want on there.
Yeah. So Lapina, I see your question about whether the materials will be mailed out to just one person on the team. That's something we need to figure out with you all. Like if you're in very different places, then maybe we split the packet. If you're in the same place, it might be easier to just send everything to one person's address and have you all figure out how you want to split it up.
Yeah, I think that is a really good question. Thank you, Lapina, because you and Janet, I believe, are in separate cities, right? But, like Heather and Rachel are both in San Diego, so it would work to just send one package for them. So I'll follow up with you all, and then we can decide what works for each team, and maybe splitting them up for certain teams will be better, and that's fine.
Yeah. And then we'll also be sending you we have some new postcards that you can use just to give people information about PWN. If women are like, well, what is this? Or the organizations you go to are wondering what this is, you say, I want to come announce it at a support group, and they're like, well, what is this organization? We have these new flyers that you can use that talk about PWN, our work. They have our contact information on there. We have some photos so people don't feel like we're just sort of an invisible hand, kind of trying to come and do research on folks. We don't want people to feel that way. And then we also are creating we have created a private place on the PWN website for all of you to go. And I'm going to actually put the link in the chat box as soon as I stop talking here, because you can actually look on there right now and kind of start to see what's up there. We're putting all of these materials that we're talking about are going to be up there so that you can go on there anytime. Like if you're like, I lost my forms. Just don't lose the gift cards because we can't replace those. But if you lose the forms, you can always go online and download those. Again, you can just download them, you can print them. Also on the website, we have all in one place for you, the recordings of all the webinars, the readings that we asked you to do before, and any other kinds of materials we create, like the flyer, any other sort of stuff. We'll put it all up there for you so you have access to it at any time. So I'll put that link in the chat box. And let's just see if there are any questions about what I've covered before I turn over to Narissa, who's going to talk next about the timeline and what the next steps are.
So Pat, that's a really good question. I'm going to let Nana answer that. That was something we recently talked about.
Yeah. So Pat, you mean if women want to do the survey, if women are willing to do the survey either for free or an agency offers to like offset the incentives, like to contribute more incentives that more women can do the survey, I don't see any reason why that wouldn't be good, because that would just give us more data. That would be great. We would love to have that happen. It gives us a stronger sample size, and then what actually happens is the bigger our sample size, the more statistical power our results have. Like literally when you put them into, there's this program that you can use to run the data in, and that's part of what we'll be doing is running the, especially the quantitative data where we're asking people, to rate something or tell us exactly how they feel about something. We're going to be coding all that numerically, and then we're going to be running it in a statistical software program. And this might be more information that you want to know, but basically the more responses we have, the more we can see what the associations are and what is actually significant and what's not significant. So that would be great. And yeah, we could definitely, if organizations want to support the work in that kind of way, we can definitely acknowledge them in the report. That's no problem at all. Yeah, so that's a great idea.
Thanks, Pat. Does anyone else have any other questions before we keep going? So Cindy, would a letter be available to give to a clinic about the project? So what do you mean by a letter, Cindy? Like besides the flyer, like something with more description?
Can you hear me?
Yes.
Oh, okay. Well, I don't think I'll need it. I don't know if Lauren and I will need it, but just maybe something will it be available if I need it? That's all.
Yeah, so I'm here. We're going to talk a little bit more about this, but we are here at the office to help you throughout this entire process. So things like that, if they come up, Cindy, we'll troubleshoot and figure it out and get you a letter, do whatever we need to do to make sure you can recruit at that clinic for sure.
Okay. Thank you.
And then Rachel, you asked if you're restricted to women in the San Diego area. So we're going to talk a little bit more about outreach shortly because that kind of a question is really important to think about as a team with your team member, and then with us here at the national office too. Okay, so I'm going to keep going and keep the questions coming. I'll answer them as they come along, but I'm trying to keep us on time. We're in good time actually. So we're almost done with our trainings, right? We've had 3 so far. This is our last one. And next, you all are going to start on data collection. So that data collection is going to continue through mid-July. And throughout the data collection process, which will include surveys, having people take the surveys, it'll include document collection. Us here at the PWN office are going to be available for technical assistance for you all. And we're going to talk a little bit more about what that technical assistance will look like later on. So we're estimating that data collection will go until the end of July, or mid-July to end of July. After that data collection process ends and through August, PWN staff here at the office are going to be analyzing all the data you all collected. And we'll be, sorting through things, analyzing, writing up the report, and we may need to have a couple more phone calls in August to get your all's input on that, maybe some clarification or input on the data. So that's kind of an overview of the next 3 months. Does anyone have any questions about the timeline?
Hello,
Okay.
can you hear me?
Oh, yeah, I can hear you now.
Okay. So when is the official start date?
You can
Or
start.
did I miss that?
No, you didn't miss it. I mean, you can basically start collecting surveys soon, like ASAP, as soon as you have the gift cards. Like that's all you need now. The survey is ready to go. And so what we would encourage you to do, like you'll have the gift cards by the end of next week at the latest. What you might want to do is start setting up times to like go to organizations or something like that, or start recruiting, like set the flyers up and things like that next week.
Right.
Because you'll be ready to roll by, latest next Friday when this stuff gets to you.
Okay. So because I'm asking because the form she sent out today for us to kind of tweak and add our city and add our names for contact. I did some of did the additions to the form, and I wanted to know that because I want to send it out to like local providers so they won't be surprised when we come. We've kind of like talked to some people, but however, we haven't been to all of the agencies yet.
Yeah, so that process, you can start that now, and early next week before you get that package. You want to use, you have that flyer document that I sent that you can use, but if you need other materials to start doing that initial recruitment, just let me know. We can send that, because really you'll just be waiting for that packet to come with the gift cards and then informed consent forms and stuff like that.
But you can already download the informed consent too. The only thing you won't have is the gift cards.
Okay, thank you.
And then Lupina, you have a question on here. With SurveyMonkey, you'll be receiving the survey immediately. Is that correct? Yes, so right when you click that link, you're directed immediately to the survey. And who will be password protected. The info is not password protected. Do we have it on password protected?
Wait, I'm not sure which info you're asking about, Cindy. Do you mean the survey data, or do you mean something else?
You know what? I just pulled it up. Resources for Community-Based Research Team. And, okay. So everything's here, right? That we can download from here the
It's not all up there yet. We'll have it all up there for you no later than Monday. We're just like still uploading all the final forms. But it's almost all up there now. Like probably about 70% of it is up there at this point.
Okay.
You do not need a password for that page. It's just a page that most people don't know about, so they would never see it to go there. But there's nothing private on there, so it doesn't need to be password protected.
Is this survey going to be sent to all the women that are affiliated with PWN?
No. You're the only ones that are going to be disseminating it.
You're the researchers.
Yeah, but I mean, are they going to be taking it?
No. What do you mean?
Like the rest of the women that are, like in San Diego, there's probably, 5 or 6 more women that are involved with PWN. Like, are they going to be taking the survey? Are you guys going to be sending them an email, like the people that you have all of their contact information for?
From now on, Nana and I and at the National Office are just going to be really supporting all outreach efforts that you all do with the survey. So that means we will not be sending it to anyone. Whoever gets the survey in your area is just going to be getting it from you.
Okay, and then also, like, this whole time I had thought all along that, like, we needed to do the survey with the woman, like, face-to-face, bring the computer, ask the questions. But, like, I have a pretty, I have a lot of people, I know a lot of people across the country that are positive, and some of them are, obviously have internet access, and I know which ones could do the survey by themselves. So do you want us to send it to other positive women? Like, I wouldn't post it publicly, but maybe just privately ask them if they want to take it?
Yeah, so we just want it for you to recruit in your area, and not sending it to them online, but recruiting and meeting up with them.
Okay, so that's the only way, not sending anybody the link.
Yes, right. You're correct. Because we want to make sure they're coming from we're doing this study, right, in 7 cities and areas, and we want to make sure the women are coming from those areas.
It's a geographic-based study. Like, the other data we're collecting is all going to be from your geographic region. So, meaning the other documents that we're collecting. We're going to look specifically at San Diego. When we get more clarity about where the South Carolina crew is focusing, like which counties, we're going to look just at those counties, and so on. For every area that you are working in. For Chicago, we're going to look just at Chicago data to kind of overlay it, unless the Chicago crew is doing something else outside of Chicago. So it doesn't really make sense to get surveys from other parts of the country, or even to get surveys that are disseminated not through you in those parts of the country, because we want to have the same kind of process in terms of how it's distributed.
Okay, I just wanted to make sure because I was a little confused.
Yeah, no, thanks for the question. Yeah, it's a really good question, because since it is online, it has that capability, but that's not what we're going to use it for this particular study. I think that at a later point, if we wanted to, we could talk about, after you all have done the data collection, if we wanted to open it up and have a different data set that was just like, we just like send it out, the same survey, to women across the country that we know and have them take it for free. But that's just a different data set because they're not participating in the same kind of process. Like, they're not getting the $20 because our budget won't extend to that. They might be getting it anywhere. And it's just for us to build the data out. So that's something we can talk about as a team later in the process if we want to.
Okay.
Hi, this is Ebony. I was wondering, I know that we're in Chicago, but I kind of wanted to do some of the surveys downstate because they don't have, not downstate, but in another city, but in Illinois. Is that okay, or should I just only be doing Chicago?
Yeah, no, it is okay, and we want to talk more about that when we're talking about we're going to talk about an outreach plan. I'm going to give you all some space. We're going to give you some space and time to talk about that a little bit, and that's definitely a question for your partner as well. So, okay, cool. I'm going to just go on to the expectations part, so then we can kind of get to that outreach part, because I can tell everybody's excited and wants to start talking about outreach. So I'll try to get through the other parts quickly. So these are just our expectations for you all as community-based researchers. You've already seen this before, but I'm going to go over it quickly. Continue to work as a team, so regular communication with your partner. We want you all to talk about how you'll split up the work, which parts you'll do together. You all are committing to collect a minimum of 20 surveys for your region, and yourselves and you as researchers are not included in that data set. You're committing to collect other required documents and data. We're going to talk about that a little more. You're required to maintain paperwork for this project. So that's the informed consent forms and another form that we're going to talk about shortly. And then you're required to submit any data you collect and paperwork back to me at the office here. And lastly, you're committing to participate in bi-monthly scheduled calls. So we're going to have a monthly team conference call in June, July, and August. And you all received a dual poll for that already. And then we're going to also have monthly progress check-in calls between myself and Bianca, our intern, who's coming next month. in between those team calls, and that'll just be for you and your research partner, and it'll just be about talking about, you know, issues you may have, help you may need from us, what we can do for you to help with the process. But in between that, of course, you're welcome to call me. I encourage you, please call, email, stay in contact, let me know troubles or what's going on and how I can help. And then at the end of the project, after you complete all of the above activities, we're going to issue an honorarium of $500 to the 2 research teams for a total of $1,000 per research team. And all of you will be acknowledged in the report as well as the community-based researchers. Okay, so this is important, informed consent. So we're going to provide you all with informed consent forms. We're going to send you 20 forms. Will come to you in the mail, but as Nana said, they will also be available on that webpage. Before administering the survey, you're going to need to obtain a signed informed consent form. You will need to sign it and date it as a researcher, and then you'll have to obtain their signature and date from the person taking the survey. And as Nana said earlier, this is really important to protect you as a researcher as well as the person taking the survey. You can also let them know at this time that it is a confidential survey. We are not taking their identifying information or tracing whatever information they give to us in the survey back to their identity. So you'll have them sign 2 copies of the form, and we'll send you, 2 copies. So you'll keep one for yourself, for your records, and the other person will keep one for their records. And then at the end of the project, once you have them all signed, you'll just mail them back here to our office in Oakland. Is there any questions about the informed consent form? This is just a screenshot of what it looks like, or the top of it, what it looks like. It's one sheet. It explains the project and what's going on with the project, why the study's being done, and then has a place for them to sign. But if you have any questions about the informed consent, do you all feel comfortable asking people to sign this form? Ebony says yes. Thanks, Ebony. Great. Thank you all. Okay, great. Thank you. Oh, I see them all coming in. Nice. Okay, so if you have questions about the informed consent that come up, maybe once you get it or you see it on the website, please feel free to ask any questions you may have about it. Okay. So now this is where I'm going to talk about what we're going to do moving forward. So you all will be the researchers. You'll administer the survey, collect the documents, get the informed consent form signed, all that good stuff. From now through mid-July, we're going to be here to assist you with any issues or concerns you have with the data collection. So if you want to brainstorm ideas for outreach, we can help with that. If you want a flyer design, like a different flyer design, or a letter like Cindy said, we can also do that. If you run into issues once you start giving the survey, we can help troubleshoot that as well. And then in addition to any ongoing support you'll need, we'll also hold our regular bi-monthly check-ins with you all. So one call a month, we'll all be on the call together, and then we'll hold another call with you and your research partner. And these calls are really just to support your outreach and data collection efforts. We want to make sure we're helping you, identifying any struggles you have. If you hit any bumps or troubles, we want to help figure those out. Oh, so it'll be either myself or Bianca, our intern. I see I have that up on the slide. You all have my emails up there, and that's the office number. If you have any questions about Pat, 20 women is a breeze. I'm so glad. If you all have any questions about support that we'll be providing, please let me know. Okay, so now we're going on to the outreach plan. This is the next major step that each team needs to take, is to set an outreach plan. We want you to think about where you want to recruit, what areas you want to target, thinking about geographic diversity, maybe getting into rural areas like Ebony was saying, and like Veronica and Pat have mentioned before. Think about where you want, how you're going to cover those areas and who will cover those areas. You want to think about age, where the woman receives services, payer source, insurance coverage. Think like your big picture question is, who do we really want to know about and how do we get there? So,
and I think, something that's really important is just like thinking about, while it could be important to get data from women who have different kinds of experiences, there's also a way in which it'll be helpful to have 20 women who have a similar set of experiences, whether that's like being in a particular geographic area or being in a particular clinic or payer or something. So just some stuff to think about as you all are thinking about what is your real scope going to be? Is it just any woman in your geographic region? Does she have to meet certain, criteria? How might you want to sort of scale that back and hone in a little bit more to get a better picture?
So now we want to give some space for you all to think about your outreach plan a little bit. These are just some questions we encourage you all to identify some answers to. Who do you want to be on your contact list? What are your geographic priorities? Where will you recruit? And what are your technical needs? Like Pat said, she had an iPad, and that's great. What other technical needs do you think you'll have when you're going out and administering the survey? And then who's responsible for what in your team? So we'd love to hear from you all now. You can press *6 to unmute yourself to kind of hash out or not hash out, but start thinking about your outreach plan a little bit. And I think it'll be helpful for other people to hear other people's ideas on the call too.
Yeah, maybe just kind of starting with in your area, who do you think are the most important women to reach? Sorry, go ahead.
That's okay. I'm sorry. So, me and Sharon were thinking we wanted to check with younger women as well as younger women in the city of Chicago and women that don't live in the city of Chicago. And the reason why we were thinking those two sets of women is because younger women don't really have much of a voice in the city. They don't have a lot of advocacy, people advocating for things that they need, so we really don't know what they need. So we want to reach out to them, and we actually have a program in the city of Chicago that helps with young women with kids. So it's pretty easy for us to go to one of their support groups and do the survey there. And we have contacts with some clinics downstate where they'll let us come into their support group and do some surveys there. We were thinking about so we have laptops, so we can take the laptops and just set up, and both of us there, we can do 5 women at one sitting and get it done each. Sharon is pretty much going to be responsible for setting up the surveys with the younger women, and I'm responsible for the downstate. And that's because she has experience with those women, and I have experience downstate. So that's pretty much how we have decided that we wanted to do our recruitment. And we actually have the opportunity to do more, so if we can do more, we will do more, if that's okay with you guys, because we can do more than 20.
This sounds great, Ebony. Thank you. This sounds like a really great plan, and great that y'all are already kind of thinking about who's going to do what, who has strengths where, and who can do what. Yeah. Did you have any comments? Okay. Thank you, Ebony.
Thank you.
Does anybody else want to hop off mute and talk a little bit about what plan they're thinking of so far? I realize maybe you haven't had a time to speak more in depth with your partner, but we'd love to hear ideas you have. So, Pat, you said you want to go out to the rural areas in South Carolina through the clinic. So I'm interested in hearing from Pat, you and Veronica about like counties or towns or cities you all are thinking in South Carolina. I mean, we know it's a big state. Where are you all thinking within the state to focus on?
Or is it like, are there specific target clinics you want to recruit from too? What do you have in mind?
Anyone else could come off mute too, *6 if Pat's
Hi,
thinking about.
Veronica.
Oh, hey, Veronica.
Hi.
Hi.
Pat did mention that we were talking about doing rural areas, and I think you might have started talking. Did I cut you off on something?
No, nope. Go right ahead.
Okay. And the rural areas, and I think if we don't do rural areas, we do a disservice. Although we're both very close to Columbia, we would do a disservice to the women if we don't go to the rural areas. Definitely clinics, but I'm also familiar with several support groups in some of those rural areas. Although we may not have large numbers, maybe 5, 6, 7 people that may attend. But I think that would be a good way because the rural areas are where people might have to go 30 miles one way to, get services and things like that. So that is definitely focus. And that's it.
Well, that's great.
Great. Thank you, Veronica. So you're thinking
You're
the
welcome.
Orangeburg area. You live in Orangeburg, right?
Pat lives in Orange. I live in Lexington.
Oh, Pat lives. Okay. Okay, great. So I think once you all talk, maybe we can check in after about particular areas you're looking at within South Carolina, particular clinics, just so we have a better idea of how to target those areas too.
Okay.
Great, thanks. Did anybody else want to share what they're thinking, their research team is thinking? Hit *6 to come off mute. Lauren, are we allowed to target a clinic that we know focuses on serving trans women?
So I know this question came up last time, and one of the conversations we had last time was on, in terms of doing a community-based participatory research project, the community that is involved, that's being studied should be involved in creating the questions, the research questions, and thinking through them. And so I think, based on the fact that we haven't had any trans women involved in this process, and sort of similarly with non-English speaking women, I would say that to be true to what community-based participatory research is supposed to be, it might not be the best idea to really target populations that weren't part of defining what the questions are. I would like to hear other people's thoughts about that, though, based on the trainings we had on, really how to think about community-based participatory research, and really, you all defined the questions. What do other people think?
This is Ebony again. I think what you're saying is true because they did. I mean, we don't really know what their specific set of concerns and issues are. So, like you said, we didn't ask those questions. So, hopefully, that's another research project that they can be fully involved in down the line.
Mm-hmm. Any other thoughts?
Okay, so Lauren is kind of following up on that. What if we visit a support group and there are trans women there that could they participate? Yes, Lauren. Absolutely. We're not excluding trans women from the survey. We just want to be mindful of going to a trans-specific clinic and recruiting like directly from there. So yes.
Mm-hmm.
And I have lots of other comments that I want to highlight here. So Lapina said youth, women in reentry programs, and small support groups in rural counties. So that all sounds great. Absolutely, Lapina. I think that once you and Janet hopefully set an outreach plan, you all can start targeting specific clinics or specific reentry programs in specific areas. And if you need help doing that, please let me know. We can talk about that.
And we really hope that you all
yeah,
are
we
thinking
do.
about...
This is Lapina. We do have some, I feel an echo. We do have some clinics and programs that we are thinking about entering with the youth. One of our centers here that focuses on youth, and one of our services with prison women reentry into the system. They have a housing facility. I've touched base with them, and we expect to do a support group with some women one day, and possibly just have some light meal or something like that, and get a few women that way. We've discussed this a little bit.
That sounds great, Lapina. That sounds great.
That's really good.
So Cindy also mentioned Contra Costa County in her comment, and I just want to clarify that for the whole group because I think it's important. So, in the Bay Area, we have kind of our city center of San Francisco and Oakland, and then we have these outlying counties that have really, pockets of poverty in them and not necessarily easy access to services as they do closer here. So it's like I would say like I don't want to say border county, but like a peripheral county with close to services, but maybe not that quite close. And it'd be really interesting, Cindy, to get some data from there. So thanks for raising that.
Yeah, something to just think about, though, is especially if the different counties have different funding mechanisms or different pools of money they're pulling from. So like Alameda and Contra Costa are under the same Ryan White funding. So it could make a lot of sense to do the two of those because we can look at the other documents and the data from there. But in that case, you might not want to also do San Francisco because that's like a totally different set of services, a totally different set of funding, it's a totally different set of like what's available. So I would just encourage you all to really think about honing in on what makes sense for your region and what makes sense given the epidemic in your regions, where women are, which women are really that you think and know are receiving less services or that you really have a question about. Because 20 is not a lot of women. So if we really want to know something about them, they should have some characteristics in common, whether it's like where they live, what they have access to in terms of resources, what their, maybe what their ages or incomes are, what kind of insurance they're on, what kind of clinic they go to, that kind of thing. Just think about how they can be as common a sample as possible so we can see if there are any themes. And then the one other thing I just want to raise, I noticed a lot of people are talking about age and have mentioned younger women. I just want to flag that when we talked about the questions that you all had, one of the important questions that did come up was how well are the needs of older women with HIV being met. And we know that a lot of women are aging with HIV now. It's a growing part of the population across the country, both for new diagnosis and because we're just all getting older and living longer, and we look fly. And so we really want to know for women who are aging, that was one of our key questions, is like, how well are services working for women who are getting older, especially if they're not of reproductive age? Are they still getting the attention they need around like sexual and reproductive health care services, around like thinking about menopause and HIV medication interactions and things like that? So just to put in a plug for thinking about women who are aging too, remembering back to our original questions that we talked about.
This is Lapina. In that small support group that I mentioned, that would be maturing women.
Mm-hmm. That's great. Cool.
This all sounds good. We're really excited to hear all these ideas that you already have.
You guys.
Rachel mentioned
Hello?
earlier. Is this Rachel?
Hello. No, it's Heather.
I can hear you.
Oh, sorry, Heather.
Okay.
Were you the one I'm sorry, Heather. Was it you who said earlier about San Diego?
No, I think that was Rachel talking earlier. But so okay. I was just going to add that for San Diego, being as she's located, she actually lives down in the San Diego area or the East County or down there. She's going to focus on doing the surveys down there, and I'm up in North County, so I'm going to be focusing on doing the surveys up here in North County. And also because I'm part of the CARE Partnership, which is basically a bunch of different agencies from North County as well as down in East County and down in the San Diego area that predominantly cater towards women. They're all women, like service agencies. I was going to share, sorry, you'll hear my baby in the background. I was going to share the flyers with them so that they can post them in their agencies with our information to contact us, and we can then set up appointments from there as well as at Christy's place. And I know we'll definitely hit the 20 pretty quickly just because both Rachel and I have a ton of ways to contact people here, so we'll see how many we can get. But so I was just wondering, does it matter? Is it going to be different data, or because it's still San Diego County for the North County people?
For funding purposes, it'll be the same because it's all one county. Is your county a huge county?
How does your county funding work?
Yeah.
Well, it basically, I think it goes all to San Diego County. I don't think that there, but I think it's like specified towards agencies too, and predominantly more of the the agencies that are in the higher, like that have the higher amount of people living with HIV get more funding than those, like, say, up here in North County do. Because I know there's there's a lot of North County people up here that don't have the same access to the same services unless they drive down to San Diego County, like to the actual, like, downtown San Diego area.
Okay. So I think it would probably be a good idea for your team to, for you, Heather and Rachel, to look into funding a little bit more and then thinking about funding resources and where it's allocated when you're doing your target outreach, when you're doing your targeted outreach.
Okay.
Yeah. Okay. Does anybody else have any comments they want to make about their outreach? Or I think I heard.
When you say you want to focus on the funding, like, so we mainly want to ask the women to do this that are using the Ryan White services, that are utilizing a lot of the services, that the ones that are in the most need, right?
So Can you repeat your question again for me?
What you and Heather were just talking about, like when we think about the women that we want to participate or that we are going to ask to participate in this, we want to basically ask women that are in the most need, right? Like, because I know I have contacts with women that are in a lot of need and then women that aren't, that maybe some of them have never even used Ryan White services. So you don't want us to ask people that are not that don't have the need, right?
Well, because we want to hear from folks who are using, public health care services like Ryan White and ADAPT and stuff like that to understand the barriers and stuff like that and the unmet needs stuff.
Okay.
So I would say to concentrate outreach there with those women first and kind of thinking of those as the priority for those women, I mean.
Yeah.
And then
it definitely makes sense to be prioritizing women who would need the kinds of services that Ryan White can provide. Because that's exactly what we're trying to figure out.
And then if you run into trouble, Rachel, we can chat and regroup and move on from there and figure out from there.
Oh, there won't be any trouble.
Okay.
This will be super fast, I think. I mean, Heather and I have so many contacts in the community that are women that need Ryan White and use it all the time. So I don't think it's going to be any problem.
Okay, good. Fantastic.
Okay, this is Sharon in Baton Rouge. So based on the last couple of answers I just heard, so we should be doing targeted outreach with women who are receiving Ryan White services or who would actually need Ryan White services but don't have access to them.
Both.
Okay.
So you mean like women who are, when you say need it but don't have it, is it because they're poor but not poor enough? Is that what you're, like those kind of women?
Yeah.
Or because the services aren't available?
No, it's not that they're not available. Let's just say, for instance, someone that may have a job, halfway decent job, and they may make $12 that put them over the cap and be disqualified for Ryan White services.
Right. Yeah, for sure, Sharon.
Okay.
Yeah, that's an important population that we want to hear from.
Okay.
Because, like theoretically, a big point of the Affordable Care Act is they're supposed to be reaching those certain populations that were left out of certain public health programs like Medicaid and stuff. So hearing from them is really important.
Okay, thank you.
Thanks, Sharon. So I'm going to just keep moving us along.
There's a question.
I
think we want to put it to the whole group.
Which question?
So I think this question is sort of coming up, and Cindy, I see that you wrote it in here. Is the priority women who have the most need or have a lack of services? I just want to put it to this whole group because this is really you all's decision. Like, who do we really want to know about? We didn't spend a lot of time talking about priority population. We just said women with HIV, right? But what do you all think? Who do we most need to know about? Are there any ways in which you want to propose that this gets further targeted at all? That you want to ask other researchers to sort of hold or think about, or that you're thinking about?
If anyone has comments about this, it's *6 to unmute. What do y'all think? Do we want women who have the most need or who have a lack of services, or what population are we looking at?
I'm sorry, I was talking and was muted back.
I
would think both populations.
Mm-hmm.
Women who have the greatest need, and I guess I say that because when I think about Brian White services here in Baton Rouge, like they are not the services are kind of limited. Like all of those wraparound services that Part D should provide, like child care when you're attending a support group or a doctor's appointment. Those things are not provided here in our area. Whereas if you go right down the road to New Orleans, you can get child care assistance while you attend a support group meeting, the planning council meeting, those type of things. So I would think both populations.
Okay. Thanks, Sharon. And Janet says women lacking services. Pat says, I believe we will get differences from the different areas we reach, but with a number of 20 priority women, we'll really not be able to show. I would like to know if those with the most need even know what is available to them. Yeah, Pat, I like that. Your comment a lot. That is really important. And Lauren's comment, I think that if we're really doing regional research, we need to be both objective and at the same time consistent about who we are reaching. I would not mind focusing on women of color versus Caucasian women from region to region within the same income level. Thank you, Lauren, for your comment. Right, yeah, these are all really good points. Thank you all. All right, so let's move on and talk about the surveys a little bit. Okay, so like Nana said, the survey is pretty much done. It's up on SurveyMonkey. You all hopefully have seen it by now in the link I sent you. I want to thank you all for your thoughtful feedback on the draft that was sent around. It was really, really helpful. After entering all of the questions in and, sorting through the questions, creating them, adding them in, and doing the question logic on SurveyMonkey, my eyes were bleary with questions and I wasn't able to see grammatical errors and stuff that you all pointed out to me, so thank you very, very much. If you haven't seen the survey already, please make sure you take it before you give it out to anyone. So it starts out with just a couple demographic questions, and those are really just questions to make sure we have women living with HIV taking the survey, and that women are over the age of 18. And
they can be 18.
Sorry, 18 and over. 18 and over, right? Okay. Mm-hmm. And then it delves into healthcare questions, and then wraps up with some demographic questions. So we put that really long unmet need question in there, and Pat, I want to acknowledge your comment that it was, I think you said you got tired of the question, or it was confusing after looking at it for a while. So it's the one with the 3 columns, and that's really to look at, we want to see current services offered and change in services in that one, and looking at some unmet need in that question. And that was pulled from the question that Sonia highlighted in our first webinar training with her from a previous HIV study, and then we adjusted it to the needs that we're looking at for this survey. Are there any questions about the survey?
So this is Ebony. I didn't get to send in my thoughts on the survey, and I apologize, but I don't know if anybody else sent this in, but my survey kept jumping back to number 1. So I don't know if that's an issue. That was an issue on my end, or if it'll do that again. And I assume there was a note to me. Go ahead.
It kept jumping back to question 1, is what you're saying?
Yeah. And a few different. I mean, it allowed me to get to. When?
Do you remember when you took it up?
Took it. What was yesterday? Thursday. I took it yesterday.
I wonder if it's because we were kind of like editing it yesterday, so I'm just wondering if there was something weird. Yeah, we were kind of like working on it all day yesterday. I just wonder if there was something going on while you were trying to access it.
Okay. It might have been.
Did anybody else have that issue?
Or other issues that you didn't get to share with me yet, that an email that you want to raise here? No, I hear no from Rachel, no from Lapina. Yeah, I got yours, Lapina.
Lauren, you had a problem on question 19. What happened on question 19?
I had one too on question 19. It was that you can't put the dash in the date when you go to put month, date, year. You can't put the dash in. If you put the dash in, it won't let you go through.
Okay, right. So we need to be more clear about exactly how they have to enter it, because you can only enter numbers in that box.
So you can only enter numbers, and Beecher told me this yesterday, and then I talked to Lauren about it this morning, and I was trying to figure it out, and I couldn't figure it out, and I was like, oh, you cannot put any dash in there, and we'll put it in the instructions, but I just want to say it on the call, too, when people are asking you when they're taking it. It literally just has to be 0315 if you're doing month and year, and it can't be any slash or dash. And unfortunately, we can't control that. That's just how SurveyMonkey does it, if we want to use date.
We can make that really explicit in the instruction right above, though. We can say enter it exactly as in this form, and we can give like 2 examples instead of 1, if that would be helpful.
And my last note was question 44. It asked for country. I didn't know if we were trying to capture country, because I didn't know if we were, we're not outside of the country. So were we trying to capture country or county?
I think that was supposed to be like if people were diagnosed outside the U.S. but they're living here now, we just wanted to have a way to know that. Because I think that's the diagnosis question, right? Where were you diagnosed?
I'm not sure if it was where you were diagnosed or where are you now.
Mm-hmm. We'll double check it. We'll double check that.
Okay.
Number 44. Thanks for letting us know. And then Lauren, I see another concern about the income. What happened? You had no change of income, but it wouldn't allow you to continue that question without putting in a number.
I'll look at that.
So there's a question is it a question that asks what your income change was and doesn't give a way to respond if you don't have one? Other explain. Okay. Yeah, there's a couple that don't have, like, not applicable or something. We can go back to it.
Okay.
This is really helpful.
Oh, yeah, Lauren, after you told me about that copay one, the income, I went and changed it. So it should be fixed. That should be fixed now. Thank you for pointing that out. So, yeah, so that one's done. Cindy, your other explain in 2 questions, other circle to mark was not there. I'll go back and look, but if you remember the particular questions, can you let me know?
Yes, I will let you know, Nursa. But I don't have it right now. Sorry.
Okay. Yeah. No.
Okay, I will find it.
Cool. We know where you're going to be tomorrow. So.
Yeah. Okay. That's
all right. Were there any other questions or comments y'all want to make about the survey that I need to fix? Number 40, teacher said, community outreach program offering particular programs. What's your question about that one? Oh, there should be a not sure option.
Oh, yeah. Like, I don't know.
Yep, I added that after you emailed me. Thank you. That was a really good point. Because people don't know if they even have that service available, right? Yeah, that was a really good catch there. Thank you.
All this feedback is really great.
So this is Ebony again. I did have a note down here about, I don't think I wrote down a number of the question, but it was about gynae. Do you receive your gynae care? Okay. I don't know what the question is around gynae, but I was thinking, like, some people receive their gynae care in their HIV clinic, like their HIV appointment, they can get gynae there, and then some people have to go to an actually separate, gynae appointment. I didn't know if those should, if that made a difference, if it was made more clear, or if it would make a difference at all.
Oh, okay. So right now we're not listing it as different options, like HIV clinic, other clinic, like that kind of thing?
Right.
Separated out.
Right.
That's a good point.
Yeah.
So do you happen to remember what number that question is?
I don't. I'm sorry. I should have wrote it down. But it's
okay.
Definitely
we'll
in the...
We'll find it.
We'll look it up. We just want to make sure we're getting the right one.
Yeah, I want to make sure get the right one. Okay. Thank you, Ebony.
Yeah, for anybody who was trying to respond to the survey yesterday, we're sorry.
Yeah.
We were editing it most of the days, so it might have been a little bit wonky yesterday.
Okay. Are there any other questions or comments on the survey? Okay, thank you all. Okay, so I want to go over this incentive disbursement form that Nana mentioned earlier. So this is a form just basically to acknowledge that the person who you're having take the survey receives a gift card. So you're going to receive this form in your mail materials. It's going to be just 2 pages with space, a space for 20 people to sign and date. And that's because that's the maximum amount of gift cards we're going to send you, which is 20. One thing I want to ask everyone and check with everyone is, does everyone have a Target in their area? We're thinking to do Target gift cards if everyone has a store in their region, but we want to double check first.
For South Carolina, I would lean more towards Walmart than Target. Target is not in a lot of it.
Okay.
Okay, thanks, Veronica. That's helpful.
Does anybody else not have a Target in their area?
This is Sharon in Baton Rouge. Yes, we do have 2 Targets. However, they're not easily accessible by bus.
So what would be a better option in your area?
Walmart.
Okay.
So this is Ebony, and of course we have Targets everywhere, but just as a point of the women being able to get something for real for the gift card that they can use, Walmart is better because it's cheaper. So I don't, know if it's possible to get Walmart cards. We would prefer those.
Is there anybody who does not prefer Walmart cards?
So Lauren asked in her comment about whether the Target gift card works at Target Express, and yeah, it does. So Rachel asked about Visa gift cards. Nana and I were talking about that earlier and trying to decide whether we should do those so that people can use it everywhere. But we think there's a fee. There's a fee attached to that, and there isn't with like a Walmart or Target gift card.
Like with Walmart or Target, they get the full $20. With the Visa gift card, they would pay, something gets taken off the top, I think, when they make the transaction. They don't get the full amount. So we can do a mix. We don't have to do all one. That's not a problem. We can do Walmart and Target. If those two work. We just need to know what works in each region. So I think we've heard clearly that for Chicago, Louisiana, and South Carolina, and Walmart is better.
Florida as well.
And Florida
is
better. And then for the Bay Area, it looks like Target is a better option.
Does San Diego have a preference? Or Michigan have a preference or you don't feel like Walmart or Target's in your area? Available in your area. Okay, so Rachel said no, so there's no preference with San Diego.
If there's no preference, we're going to go with Target just because Walmart's a more evil employer, and we prefer to support Target.
Rachel said Target's best for San Diego. Okay, Lauren, Target for the Bay Area is better.
Do we know about Michigan?
Oh, I didn't hear anything from Michigan. Oh, okay. Deidre says she's just asking Pat. So just let us know, Deidre, when you to figure out which store works better for you guys. Okay. Okay, thank you for that feedback. So this form, the incentive disbursement form, is going to need to be returned back to PWN. You'll just put it back in that return envelope that we're going to send you all with the signatures and the date, and we'll just keep that for our records. Are there any questions about the survey or the disbursement form that we haven't covered already?
Target.
Oh, Target. Okay. All right, Deidre, we saw Target. Thank you.
I need someone I can trust. He has to be family. Get me my brother.
Is someone trying to talk?
My first cousin's pleasure.
Okay. I think we have some background noise going. If you can mute your phone, that'd be great. Thank you. So we're almost done. We want to talk about one more thing with you all, which is collecting data. And this is, I want to just bring back our purpose and think about our lens here. And, we want to really ensure that optimal quality of care and quality of life are available for women living with HIV. And then, in order to do that, we're assessing what the current state of care looks like, barriers, unmet need, service delivery gaps. And so looking back at that purpose, what documents do you all think are needed to create that picture? So on previous webinars, you all mentioned, I think someone said a transcript from a planning council about deprioritizing women and prioritizing youth over women. I can't remember who mentioned that, but I do remember it being mentioned in a previous webinar. And Nana talking about obtaining that transcript so we can use that in our report and talk about that change in funding and deprioritization. So thinking about other documents.
And especially documents that might be available everywhere, like, or that you think are likely to be available at different health departments. So some examples that could be, that folks might want to think about are like the needs assessment. Like if your planning council or your county has done a needs assessment in the last year, that could be like a source of data we might want to look at. Also, any documents that show how services were allocated or prioritized, like every EMA or TGA is required to write a report, write a proposal, write a report, document how they prioritize populations, how they prioritize services, and what the utilization was every year. That's something else that we could look at. We aren't expecting you all to look at all this stuff. We would just need you to get it for us, and then we would kind of do the analysis on it and maybe compare. So say you got something that's like this year, what happened for this fiscal year, which is ending soon, and then we look at something and compare it to what were they allocating funds to, say, 3 years ago. How has it shifted, if at all? That's just an example. Another example might be if your area has done any kind of care continuum or care cascade to look at how folks are linked to care, retained in care, engaged in care, and especially if they've done that for women, or if you can make a request of your health department to give you that data for women. They might not get it to you, or they might take a while to get it to you, but you can always put in a request. That's your right as a resident of the county to say, I want to know, how many women living with HIV in this county do we know are linked to care, are retained in care, are virally suppressed? Do we have CD4 counts for? You can always ask that information. What are other thoughts? I know that folks are really involved in planning councils and different kinds of advocacy in your areas. What do you think are some good examples of data sources for us to consider?
So I'm going to go back to our domain too, because the first three are really going to be answered by the surveys, right? And then the second two, when we're looking at infrastructure and changes, we're really going to use documents to assess that. Looking at Health Department and AIDS Institute, yep, great. Lupina,
I just want to say, hello?
Go ahead, we can hear you. Go ahead, we can hear.
I just wanted to say something like, okay, so I've only been to a couple of the planning council meetings in San Diego, but I'm joining. Anyways, yesterday I went to a priority setting meeting for the planning council, and they were showing like the percentages of who is infected with HIV in San Diego, and it said only women only made up like 1% of the infections in San Diego. So I feel like either I missed something, or that's just, that can't be right.
So, like, getting that report and looking at where the heck they got that number from?
Yeah, because, like, for instance, I know
useful.
There's, like, almost 12,000 people in San Diego County that have HIV or AIDS. And I know, like, Christy's Place, I believe, has 1,200 clients in total. So that I don't know. I guess I was just really confused.
Right. So it'd be interesting to see what that report, what it says, where they even get that number, where they're collecting their data from, and what they're basing their report on.
I'll find out. I'll find out where I can get a copy of it.
Great, thank you.
Because just them saying that yesterday made, 1% of anything really isn't that much. So it just made women and families seem so small on the scale,
Mhm. Mhm. Yeah. And they said this out in a meeting, out loud?
Yeah, there was a whole slideshow presentation. I didn't ask because it was only my second time there, and I may have missed something, but it doesn't seem like I missed something. I mean, it was pretty clear what the slideshow said, so I'll find it. I'll find the slideshow. I think it's on the county website, and I'll send it to you.
Okay. Thank you. Yeah, I don't want to look at that. And Meta says working on getting information ASAP and clarifying that information will be really important. Exactly. So thinking about what kinds of documents and what kinds of reports is going to be part of y'all's next step when you're meeting with your research partner. Okay, so part of the data collection process, like we said, is really important to get a picture on what the infrastructure looks like in your region, what's going on, that stuff we can't get from the survey. So it'll be really important to get that. It'll be really important for the report. So let's keep talking about it in the next couple of weeks as y'all get started with surveys and start thinking about where to collect that data from. And we can do some more brainstorming and targeting on our monthly call in June.
So I can say, now you want this data, the data we're going to be collecting, to be 2014 data or 2013 data? And the reason I'm asking because we just started our needs assessment. So actually they just went out as of yesterday. So I know it'll probably be late July before they're all done, because this is the information we're going to use for our priorities and allocation setting. However, I can easily access the 2013 data set.
Yeah, so we'll look at the 2013 one, and then we can look again at the 2014 once it comes out, but we'll start with that 2013 one. And the most recent one's important because we really want to look at changing healthcare landscapes, right? And we really want to look at changing priorities, particularly with ACA implementation and Ryan White changes and things like that.
But we know that in most places, data more recent than 2013 is not really going to be available yet. So the most recent we can get is good.
So Lauren asked a question about undocumented people showing up in the report. There won't, I don't know, but I don't think there will be distinctions. But Ryan White does cover undocumented people.
Yeah.
However, for all services, including dental services, medication, and all of that, but I don't know if there will be any distinctions that we can see from those reports. I don't know. Does anyone else have any insight on that they want to share?
We wouldn't be able to.
Okay, so Dan is saying we won't be able to see immigration status from there, from the reports. So from here, I'd like it if everybody just kind of thought a little bit more and talk to your partner about the data collection aspects and how the data collection and the survey collection are going to really complement each other so that we can have the most thorough report we can.
Yeah.
So really think about that complementary relationship and how what you need to gather to support the surveys. All right, so we're almost done. I know it's Friday night and probably everybody's going to go out and have a fun night, and I'm just going to go home.
And the Warriors are playing. The Warriors.
Actually, I'm going to go home and have pizza and wine, which I'm really excited about. I'm going to share that with everybody. Hopefully everybody has a good dinner, too. Okay, so next step, can y'all send me your address so I can mail you your materials next week? So please, I've gotten addresses from some folks. Send me your address, and if you're not in the same area as everybody send me their address and send me which address you want the materials to be sent to. So you'll have to talk to your partner, let me know who to send it to. If you all are in different locations, I can split the package and send them. Just please let me know. Respond to the doodle poll that got sent out. Cindy, we just resent it to you. You said you didn't get it. I got some responses already, and that's just for scheduling our calls to get them on your calendar. And then those are just going to be the required monthly check-in calls, but please continue to reach out to me as you get your packages, as you start doing your outreach, and as you start surveying people so I can help in any way that you all need. Meet with your partner to set an outreach plan, and this is all one again too. Meet with your partner to set an outreach plan so y'all know what areas you want to prioritize. And then launch your data collection. Woo-hoo! Thank you. Oh, what are folks' Friday evening plans? Nana's under my name. I'm talking. Yeah. So that's the next step. That's all I need from you all. Anybody have any final questions? Comments?
Pat's asking about sending more than 20 what?
Informed consent, probably.
Like the forms that they're going to fill out? Okay.
Yes, okay. So you're saying for sure you want 30? Okay, I will send you 30. Let me know between you and Veronica who you want me to send it to, or if you want me to split it, one package, whatever, let me know. You two talk and then let me know. Okay, so just between now and Monday, what I absolutely need from everyone is your address. And if you're splitting the package or not, let me know. Like top priority for our next step. And then to set an outreach plan.
Let us know if you have any questions.
Oh yeah, of course. And Lupina, we know Florida will do your best. We absolutely know that. Y'all are amazing. Yes, we will. Yay! Go team! Woo. Okay. Any final comments or anything? Are you all good to go?
So exciting! Getting ready to rock and roll here. So we're taking the feedback on the survey, so don't start circulating it yet because we're incorporating the edits you just gave us over the phone too. We'll send you an email on Monday and let you know that it's like all done and incorporated in there.
Cool.